as a result of it, or having trouble providing care as a result of the failure to expand Medicaid. So I want to turn things over to Alice.
Thank you, David. Thank you, Sheldon. My name is Alice Weingartner, and currently I'm the director of the Community Health Center here in Shawnee County. Effective on Friday, we will become a Grace Med clinic, and we will have the opportunity to, again, expand care to more people. That's the ultimate goal of the transition that we're making. I think one of the several important things that I want to point out is that currently our Community Health Center serves about 5,700 people, and that equates to about 18,000 visits a year. Statewide, there are community health centers across our state that are providing care to over 260,000 people. And so there's a very important safety net system in place that would benefit greatly from this expansion of Medicaid. We have a number of patients, about 33% of our patients right now, who do not have health insurance. And so having health insurance, as Sheldon has explained, would be a great benefit to them to come in. You know, I can't tell you the number of times our providers express their frustration and concern when a patient finally comes to get care and they haven't been there for a long period of time, and now they're in our office needing all kinds of care, needing all kinds of services, and they've avoided it because they couldn't afford it. Statewide, 42% of the patients served by safety net clinics are uninsured across our state. That's a huge number. In Shawnee County, of the 5,700 patients we've been serving, 69% of our patients are living below the federal poverty level, meaning that family of four is living on less than $24,000 a year. In our clinic, just based on those numbers, we had 3,900 people who fell into that gap and aren't eligible for Medicaid or eligible for health insurance through the marketplace, and that's because they make too little money. Again, our staff sees these faces of these people every day, and our folks really want to help people be healthier, but it's hard to do when they can't come in because they're scared about the bills that they're going to receive. We have several instances, I mean, I could tell many stories of what our folks have experienced in helping patients. You know, you have the person who's graduated from college who now has a job, but still can't get health insurance through their employer or through the marketplace because they may not be making quite enough money yet, and they're now a little bit too old to be on their parents' plan. We've even had an individual who's come in who was homeless, and because he was a childless adult and not disabled, he's not eligible for Medicaid. And so he still works, but he's still below the poverty level. He's ineligible for any tax credits, and he still can't afford his health care. Our staff get very frustrated and very discouraged at having to tell people that they can't afford health insurance through the various programs that are available. This again continues to leave these patients uninsured and often having to decide, am I going to go to the doctor, or am I going to feed my family, or am I going to pay my rent? And I continue to ask, how can this be acceptable? How can we let this happen in our state? Sheldon talked about what would it mean for Shawnee County if we were to expand Medicaid. And we know from previous studies that the clinic alone could benefit from at least $1.2 million in providing care if more folks were covered. With this transition too that we're looking at with Grace Med, one of our top goals is to serve more people. And our goal is to be serving about 25,000 people over the next 5 years. In order to serve more people, we have to have more staff. So again, that does have a positive impact on our local economy. We also have patients who need to establish a medical home, and when they have a medical home, they're less likely to impact the emergency rooms. It would also mean we would have fewer people, like I said, deciding between the rent or the food issue. I've contemplated this a lot lately, and I think one of the things that I find most frustrating, and I think everyone will agree, is that we have policymakers who really have the job of focusing on creating policies to help our communities be healthy. And then that allows us as service providers to serve those people and ensure that our communities are strong and healthy. So I thank you for being here, and I'm sure we'll take questions at some point.
My name is Curtis Sneeden, and I am with the Greater Topeka Chamber of Commerce. I'm their Vice President of Government Affairs. The Topeka Chamber is an organization of about 1,100 local businesses working together to try to make the future more prosperous for our members and for the community as a whole. And we understand that if any of us is to prosper, then all of us need to have an opportunity to prosper. And so for that reason, our mission must be broader than simply working to reduce taxes or reduce the regulatory burden on businesses, although those remain very important issues to all businesses. But our writ must be broader. It must include working with the other stakeholders in this community who all have a role in trying to make Topeka and Shawnee County a better place to live, work, and play. So that's what our organization does in conjunction with some of our sister organizations, Fast Forward, Go Topeka, Heartland Visioning. You might have heard of some of those. Now, it might be tempting to conceptualize the idea of 150,000 uninsured Kansans as a social services issue or even a faith issue. But I'm here to follow up on Sheldon's remarks by assuring you that it's a business issue as well, for at least two reasons. The first one is that in our county, the healthcare sector is an enormous part of our economy. The large hospitals, the smaller healthcare providers who provide service to patients across Northeast Kansas account for something on the order of 17,000 jobs here. Something in the range or more than 10% of the revenue generated here comes out of the healthcare sector. And really in Shawnee County, because we are a regional healthcare center, the impact of the healthcare industry on our economy is much more pronounced here than it is as a percentage in the state and even the nation as a whole. So the decision not to take advantage of those federal dollars and work to try to close the Medicaid coverage gap has cost Topeka and it's cost Shawnee County in those strictly economic terms. That's a relatively linear type of argument to make. But this is a business issue in another sense also. Our organizations are in the business of trying to grow the economy. We are working to attract new businesses to come here, and we're working to help existing businesses expand. And so one thing we've learned fairly readily in recent years is that the companies that are out there across the country and across the globe who are considering relocating have a long list of things they look at when they examine communities. And we're finding out that, well, frankly, the simple issue of the corporate tax rate isn't usually even in the top 5 of the things that they're considering. Normally, taxes comes in about 7th or 8th. At the top of the list is a ready supply of skilled workers, and they need to know that they're going to be moving to a place where their families are going to want to move and where they'll be able to recruit the skilled talent they need. They need to know that Topeka is a great place to live. So, the decision not to expand Medicaid coverage is probably not explicitly noted by any of those companies out there. When they consider Topeka, they look at all of those factors, and it's unlikely I could come up with an example for you of a company that said, well, we noticed that Kansas hasn't expanded Medicaid, so we don't want to go to Kansas. But the process is subtler than that. The professionals who represent those companies compile long lists of locations that are candidates for the new headquarters or the new factory or the new call center. And their job, their incentive is to try to eliminate candidates from that list. They're trying to shorten that list to get down to a final decision. And any policy that this state pursues, which has the tendency to create the perception that the quality of life here might be declining, gives them all the excuse they need to take us out of the running. And I would submit to you that a policy that places an undue strain on our healthcare system, which is damaging our healthcare providers, and which is leaving 150,000 Kansans uninsured, is that type of policy. And so that's why the Topeka Chamber, along with at least 21 other local chambers across the state, support the sorts of proposals that we saw last year, bridge to a healthier Kansas. We believe it's long past time to find a common sense compromise here, bring those our federal tax dollars back here, and figure out a way to provide coverage for those 150,000 Kansans who are falling through the gap. Thank you.
First Singer, I currently have the honor and privilege of being the CEO at Vallejo Behavioral Health Center. One of our executive team, Dr. Seidlinger, is in the audience. I don't know if anybody else is or not. So I've been here for 9 months, but I've been running community mental health center since 1984. And the comments I want to make about Medicaid expansion, I would like to put in the context of other public policy and funding decisions that have come to bear on public mental health in the last 9 months and for sure in the last 7 or 8 years. So in public mental health, we have 26 licensed community mental health centers all across the state of Kansas. Vallejo is one of them, one of the larger ones. We operate on about a $20 million budget, have 365 staff, serve only Shawnee County, have a wide range of programs. We do everything but provide inpatient psychiatric hospital care, which our partner Strongmont Vale West does an excellent job of. So the funding streams, the funding makeup of a community mental health center is a complex connection of revenue streams that are interdependent on one another. Mental health centers are supported by your county property tax dollars, by some state grants, by a small amount of federal grant money, as well as donations and out-of-pocket fees. But in the main, because that's how we built the system particularly about the last 25 years, community mental health center funding is built all around Medicaid. So I like to talk to my friends and colleagues in general medicine and some of the more traditional medical specialties that Medicaid is to a community mental health center like Medicare is to a hospital. And so much of our funding comes from Medicaid, something like 60%. So in a $20 million budget, we're billing out about $13 million a year. And so when a 4% cut is announced to Medicaid rates, not just to mental health centers, but all Medicaid providers, first reaction you might have is, well, 4%. But 4% of $13 million is $530-some thousand if I've done my math correctly. That's what Vallejo stands to lose in the next 12 months just because of a 4% Medicaid rate cut. And then you add the failure to expand Medicaid, which is difficult to calculate, but I will tell you that 27% of our consumers are uninsured individuals, have no insurance whatsoever. I'm guessing that most of them would qualify for an expanded Medicaid program, which would provide Vallejo with some revenue that we're not now able to collect from those individuals. So those 27% of our clients bring in 10% of our revenue, so you can see the amount of charity care. Last year, 2015, calendar 15, Vallejo provided $2 million of charitable care to the community, and we're not going to be able to afford to do that going forward into the future, not to that degree. Not only because of the 4% proposed Medicaid cut, not only because of the fact that Kansas has yet to expand Medicaid, but because there have been a number of other public policy decisions made in just the last few months. For example, there's some increased managed care procedures and cost control procedures that are affecting all providers. There was a program where Medicaid recipients were required to be evaluated by a mental health professional before going to a nonprofit or a private psychiatric hospital. That program was abolished and has created cost in other areas. And there's just been a number of other changes. There was a program in Medicaid called Health Homes, not home health, Health Homes, a little bit like a medical home, but it's a program that takes an enrolled Medicaid recipient, says to the individual, how can we help you improve your health status? How can we help you bring your blood pressure down? How can we help you stop smoking? How can we help you lose some weight? How can we help you exercise more? So we've worked with these individuals, hundreds and hundreds of them. 700 or 800 usually were on the caseload just in Shawnee County, and came up with a health action plan. And we called them on the telephone. We went to their house and visited with them. We had them come to the office. We wrote them letters, sent them messages. How are you doing? How's it going? Have you found a doctor? No. Can we help you do that? Can we get you to that appointment? A program that was working and I think doing a great deal of good in our society was terminated. And it ends actually, it's tomorrow, the 30th of June. It ends tomorrow. Laura's, yeah. So that program actually ends tomorrow. Vallejo will lay off 9, actually 10 staff because of that. All of it, about 3 of them are already gone as the program has started breathing its dying breaths here in the last few weeks. It's a loss of revenue for Vallejo, but even more important, a loss of a health resource for people whose health is often compromised. So I can think of 4 or 5 Medicaid-related public policy decisions just in the last 8 or 9 months that have had a very serious effect on the health care of our people covered by Medicaid. And as Sheldon pointed out, we're going to pay that bill in some other way. Higher taxes, higher premiums, longer wait lines, because the people don't go away. The payment source tends to go away. So when you add some other factors in there, like the fact that state mental health grants have been frozen or cut pretty dramatically in the last 8 or 10 years. If my math is rough in general, but I believe state mental health grants at one point, when we started downsizing our state hospitals, because we could, was about 36 or 38 million. Rick, am I close on that? I believe now it's around 15 or 16 million. That's statewide in all 26 mental health centers. So that and some other things, some unfunded mandates, HIPAA, and some Department of Labor regulations that are coming up fairly soon. There's been 8 or 10, maybe a dozen public policy decisions just in recent history that have had a specialized effect on community mental health. That specialized effect being that because of the way those funding streams were integrated and built on one another over the last 60 years, when you change one part, you change another part. And the system has been kind of systematically being shredded over the last 8 or 10 years. It's just getting more and more difficult. What that means is that not only will services to people with Medicaid be disrupted in some cases in mental health, people who are uninsured will have less access to mental health care than they previously had because of the way these funding streams were interacted. So where Medicaid fell short, maybe a grant came in. Where a grant fell short, maybe a Medicaid rate paid pretty well. These where all else failed, some county money was there propping us up for nearly 60 years. So governors, legislators, volunteer mental health board members, licensed staff, paraprofessional staff, legislators, counties have all come together in the last 6 decades to create a public mental health system that's now whose unique mission is being threatened pretty seriously, and not just because of Medicaid expansion not happening, but because of a number of variables I've tried to summarize here briefly. So, care to the uninsured, care to people with Medicaid will be affected at mental health. No one will be turned away, but services are going to have to be a little more tightly regulated in the way we meet those out. I'll stand down now and wait for questions later on, and be glad to visit with you folks. Thank you for hosting. We appreciate the use of the facility.
Hi, I'm David Setchell. I'm the president at St. Francis Health, and I tend to wander around when I talk, so that's why I chose to grab this one. Where to begin? The recent 4% cut in Medicaid rates is going to cost St. Francis Health about $1 million a year. The failure to expand Medicaid is going to cost St. Francis Health up to $10 million a year. That's a pretty tight squeeze on our organization. You may have read recently that our parent corporation has made a decision to seek a new owner for St. Francis Health. I'm not going to say that failure to expand Medicaid is the sole reason why, but it's a big reason why. It's interesting to note that our current company, SDL Health, owns hospitals in multiple states. We're the only facility in the only state where they operate that has not expanded Medicaid. We're the only one being divested. So again, it's not the only reason, but it's a big reason. Now, when you think about the economic impact, how that extends to others, when you lack that kind of reimbursement in a hospital setting, and you're taking care of folks for free in a hospital setting, one of the things you have to do is you have to tighten down your expenses. And part of that means you're reducing your employees' hours from time to time. That creates an economic impact for your associates and their families. The other thing it does is it puts upward pressure on the prices that insured customers, insured patients, and their employers pay for that insurance. And that's a negative impact to the community as well. So all of these things, it's a perfect storm, and it's causing lots of issues. But I think the more important thing, and Sheldon touched on it, is that folks could die over this. I'm going to tell you a story. It's a hypothetical story. This is not a real patient, but this is the type of thing that could happen in this situation, and it is serious. I'm sure you've all heard of congestive heart failure. It's something that could be very serious. It can kill you, but it also can be treated very well in a primary care setting with a primary care physician, and you never have to step across the threshold of the hospital if you have it. But think of somebody who doesn't qualify for Medicaid now, but could qualify if it was expanded, who starts feeling bad and happens to have congestive heart failure and he's gaining a little water weight, he's got shortness of breath. So he goes to the emergency room. So he goes to one of our emergency rooms because he knows the emergency room is going to take care of him, and we will absolutely take care of him. We'll get them squared up and ready to go home, and then we're going to ask them how they plan to pay for that visit. Imagine having something like that happen, and then you can't pay, so we don't keep you hostage if you're leaving the emergency room and you can't pay then, but you get a bill at home, and there's responsibility and there's stress that goes with that, and it wears on you, and then you don't follow up. Whereas if you could have gone to a primary care doctor, you could have followed up and you would have felt more relieved. That's how someone can die. That's what I got. Thank you.
I'm Dr. Eric Both. I'm currently the Vice President of Primary Care and also Behavioral Health Services at Stormont Vale, and I've been here in the community for 32 years as an internist, practicing for 30 of that. And I think it's important as I go around anywhere in the state particularly, friends or former patients will stop me and say, so what's about this sort of Obamacare stuff we've got to take care of? Or, what do we worry about? What should we do? How do we vote? And it really set me thinking about some of these issues in detail over the last few years, particularly now with this incredibly misguided policy move to not bring in an expansion of Medicaid. And I said, let me give you some examples, and these are real life examples for patients that I've dealt with. The first one being an individual, young woman, student, bright, shining, going to be an aeronautical engineer, but made too little money to be in the commercial programs, but could not afford health care. How ridiculous. And fortunately, I knew her well enough that we just, of course, gave out health care like many people do. But the same person would sit on decisions to come get health care. Another example of a young woman that left a job, had a good plan for another job that didn't work out, had a period of time that she was off health care, and guess what? Young people get pregnant. Imagine that. But now you have what's called a pre-existing condition, and if it weren't for Obamacare, had she had health insurance, she could have transferred health insurance across to her new health insurance, but she had no job. So she was not making any money, and she would have easily fallen into that gap that expansion would have patched. She went without health care. Imagine that. And then, very touching, a patient of mine that I had for over 20 years, excuse me, lost his job. A lot of people out of work. He started having fevers. Ignored it. could have come in for health care, could have come to my office. 6 months later, came in, white as a sheet. I said, good heavens, boy, what's going on? He was 43 years old with 2 kids and a wife. And he said, I can barely walk. He developed bacterial endocarditis. Had he been treated 6 months earlier, he probably would have been cured. The bacteria had eroded through his aortic valve. They took him to surgery, and he died shortly thereafter. And that is inexcusable. Inexcusable. Now, in the healthcare arena, excuse me, as I compose myself for attempt to, we have a tremendous behavioral health problem right now. Look around. Who's doing these mass shootings? It's not healthy, psychiatrically stable folks. Who's ending up in jail? About 90% of them are psychiatric or drugs or behavioral health. If you look at the women's facility out here, we're working with one of the psychiatrists from there. Over 90% of these folks are behavioral health. And if they're unemployed, and if they don't have the money for commercial health care, which of course they don't, they're not going to get that mental health care. Now, they'll end up somewhere, and that may mean jail. And if they end up in prison, that's $80,000 a year, and who pays for that? The point being, that gap can be patched. And rather than being criminals, many of these individuals can be healthy patients that are on medication, that are productive members of society. So, hopefully, we'll all step up and toughen up and soften up our incredibly intransigent legislators and say, get a grip, folks. You're happy to take money, roads, you're happy to take Department of Defense money. If they landed an egg of $2 billion on an expansion of Fort Riley, we'd be doing backflips, wouldn't we? Would anybody have turned that down? Mm-hmm. But in the end, we're looking at possibly $2.4 billion with a B that our legislators are depriving us from in Kansas. And that is inexcusable. Thank you.
We want to really have these conversations and learn about how this policy decision is impacting us on a personal level, like we heard so eloquently from Dr. Goff. How the failure to expand KanCare is impacting the waitress who waited on us last week when we were in Dodge City, and who wants to keep working she has a 2-year-old at home and goes to college, but she earns too much money as a waitress to qualify for insurance. And we know that those people are our family members, they're our friends, they're Kansans, and they fall into the coverage gap. But too often they're just part of the bigger number, the tens of thousands that fall into the coverage gap. So I want to take a few minutes. The reason why we have these big notepads and you have yellow stickies in each pew